Welcome to Vitality VIP's Wellness Elite channel. Let's start.
Hi, I'm Dr. John, a supporter of natural healing methods. Vitamin B12 deficiency is a serious health problem that can often be overlooked, even by doctors. This is because the alarming effects of B12 deficiency can appear even when the concentration of B12 in the blood is normal. It may sound unbelievable, but that's how it actually is. That's why I believe that the current B12 standards are underestimated. Overall, I consider the topic of vitamin B12 to be extremely important, so I encourage you to listen to the entire video. I will not only talk about the symptoms indicating a lack of B12, but also about who is at risk of deficiency and how to effectively saturate the body with this vitamin. Before we begin, I have a request. If anyone would like to contribute to the growth of our community on this channel, all you need to do is click the subscribe button below the video, and then the bell icon that appears next to it. If you find my videos helpful, I think it's worth doing, as subscribing will also ensure that you don't miss out on other valuable videos. Thank you in advance, and let's get back to the topic. Generally, when most people talk about B12 deficiency, they mean anemia. Indeed, one of the consequences of B12 deficiency is the development of anemia, specifically megaloblastic anemia. Before I list the signs associated with anemia from B12 deficiency, I must also mention that the lack of this vitamin causes much greater havoc in our body. Therefore, in terms of health consequences, I consider B12 deficiency to be a much more serious problem than, for example, iron deficiency, which also leads to anemia. Let's focus first on anemia itself. When we lack vitamin B12, there is a disturbed production of red blood cells, or erythrocytes. Specifically, they are characterized by a damaged structure and have an abnormal appearance. I mean, they are unnaturally larger in size. Hence the name megaloblastic anemia. Such damaged red blood cells also have a shorter lifespan and reduced ability to perform their functions. This, in turn, triggers a cascade of consecutive ailments. For example, people with B12 deficiency complain of chronic fatigue and constant weakness. However, I must emphasize that such increased fatigue occurs not only due to increased physical activity but also appears even during basic daily activities such as shopping, cleaning, or walking the dog. Individuals with a lack of B12 are generally deprived of vital energy and often feel as if they are out of breath. However, rest, including sleep, is not enough to fully regenerate our body. It should also be noted that during a B12 deficiency, shortness of breath may occur during physical exertion, which is associated with insufficient oxygenation of the body. Pale skin with a yellowish tint is also a sign of B12 deficiency, similar to iron deficiency, as our skin loses its rosy color and becomes lighter. This change is most often noticeable in the areas around the mouth, lips, and eyes. As a side note, premature graying of hair can also occur during B12 deficiency. People whose bodies are not adequately saturated with vitamin B12 may also experience headaches and dizziness, which is caused in part by brain hypoxia. As for symptoms related to anemia, tachycardia or accelerated heart rate may occur due to a lack of B12. This is because damaged red blood cells, which transport oxygen, are unable to effectively deliver it to all cells, leaving them hypoxic. To prevent this unfavorable phenomenon, the heart begins to work faster and pump blood more quickly to make up for deficiencies associated with insufficient oxygenation of cells and tissues. Another consequence of anemia from B12 deficiency is difficulty concentrating and maintaining attention. People with this problem often report feeling distracted. A fairly characteristic symptom that may indicate a B12 deficiency is the appearance of so-called beefy tongue. This refers to our tongue becoming shiny and smooth, caused by inflammation and atrophy of its surface papillae. In isolated situations, mouth and tongue ulcers may also occur, accompanied by pain and burning. As I mentioned earlier, the result of a vitamin B12 deficiency is not just anemia, but in my opinion, a much more serious problem is the appearance of neurological changes in patients who do not provide the appropriate level of B12 in their bodies, which in some cases can even be irreversible. These problems arise because vitamin B12 is involved in the formation of the myelin sheath that protects nerve cells from damage. When it is lacking, in general terms, there are disturbances in the functioning of the nervous system, which give rise to a series of unpleasant and dangerous symptoms. At the same time, I would like to add an important piece of information that in some patients, only neurological symptoms appear, while there are no signs of anemia, which means that problems with the nervous system do not always go hand in hand with the anemia I previously discussed. Due to neuropathy, or damage to peripheral nerves, paresthesias, or tingling, burning, and numbness in the limbs may appear. Sometimes we may also have tingling in the fingertips of the toes. It happens that this is even the first neurological symptom of B12 deficiency. If we allow the problem associated with a lack of vitamin B12 to deepen, then additional signs may appear in the form of sensory disturbance, weakness of the legs and arms, and some patients with B12 deficiency report decreased coordination of movements and instability in gait. A specific neurological symptom, whose occurrence with high probability indicates a deficiency of vitamin B12 in our body, is the so-called thermite sign. It consists of the appearance of characteristic pain when bending the head forward or simply flexing the neck. Patients often describe this symptom as a feeling of current that runs along the spine, but I will note here that this condition appears quite rarely. If we talk about health consequences related to damage to the nervous system due to a B12 deficiency, among them, I can mention other ailments, including primarily urinary incontinence, erectile dysfunction, and even deteriorating vision and hearing. It is also important to emphasize that a lack of B12 can lead to a decrease in mental performance, which is known as secondary dementia. Fortunately, when we replenish our bodies with vitamin B12, we have the chance to reverse this unfavorable effect. Neurological symptoms can also include orthostatic hypotension, which is a sudden drop in blood pressure when changing body position from lying down to sitting or standing, resulting in the appearance of stars in front of the eyes. In the course of developing a B12 deficiency, certain psychiatric symptoms may also appear. These can include mood disorders, anxiety, depression, hallucinations, personality changes, and even the development of psychotic disorders. Just a quick reminder: if you haven't already subscribed to our channel, click the button below to get more interesting knowledge about your health. When it comes to a B12 deficiency, I must mention one more important issue, namely that this vitamin is involved in certain biochemical processes in our body related to the transformation of homocysteine. Homocysteine is an amino acid that is produced in the body through various chemical reactions. When there is a lack of vitamin B12, homocysteine accumulates, causing an increase in its concentration in the blood, which in turn causes further health problems. This is because homocysteine is atherogenic, meaning that when it is present in excess, it accelerates the formation of atherosclerotic changes in our arteries. Additionally, it has prothrombotic properties and contributes to the formation of blood clots in veins. With this information in mind, it can be said that one consequence of a B12 deficiency will be the occurrence of circulatory system disorders. As you can see, a B12 deficiency is associated with serious health problems. Therefore, in summary, I will now list who may be particularly at risk of having a low B12 level. First and foremost, we are talking about patients who struggle with absorption disorders of nutrients. This group includes individuals diagnosed with Crohn's disease, small intestinal bacterial overgrowth, SIBO, celiac disease or Helicobacter pylori infection, which is associated with gastric mucosa inflammation. B12 deficiency also occurs in individuals who have undergone stomach or small intestine resection. Of course, vitamin B12 deficiency also occurs in the course of so-called Addison-Biermer anemia, also known as pernicious anemia. This is an autoimmune disease that damages the stomach's parietal cells that produce intrinsic factor called Cassell's factor. I mention this because Cassell's factor binds with vitamin B12 in our digestive tract, allowing it to be absorbed. Therefore, despite delivering B12 with food, without Cassell's factor, it cannot effectively enter the bloodstream and cannot be used by our body. Vitamin B12 deficiency is quite often observed in elderly individuals. There are several reasons for this situation, including mainly the syndrome of vitamin B12 malabsorption. This is because in older individuals, atrophic gastritis often occurs, which causes mucosal inflammation of the stomach. Moreover, the older we get, the more we struggle with a decrease in hydrochloric acid concentration, which only hinders the release of vitamin B12 from food. It is also essential to emphasize that we can lead to B12 deficiency by using certain drugs. I am referring to proton pump inhibitors, such as omeprazole, and H2 receptor antagonists, such as ranitidine and famotidine. These drugs are usually used for stomach and duodenal ulcers and to alleviate gastroesophageal reflux. I classify metformin as one of the drugs that can contribute to the development of vitamin B12 deficiency, which is one of the 10 most commonly used medications in diabetes. Literature data clearly shows that even in nearly 1/3 of patients taking metformin for a prolonged period of time, B12 deficiency may develop. This is partly due to the fact that taking metformin can disrupt the binding of vitamin B12 with the intrinsic factor, which significantly facilitates the absorption of this vitamin through certain biochemical processes. Unfortunately, this problem is often overlooked. The reason for this is that, as I mentioned earlier, not all cases of B12 deficiency present with hematologic symptoms, such as those associated with anemia. Sometimes, mainly neurological symptoms resulting from neuropathy or nerve damage appear. And crucially, these types of symptoms can also be caused by diabetes itself, known as diabetic neuropathy. So we have the following situation. A patient with diabetes who takes metformin visits a doctor and complains, for example, of tingling and numbness in the limbs or burning, stinging, and pain in the feet. The doctor then makes an inaccurate diagnosis, attributing these symptoms to poorly controlled diabetes, when in reality, these symptoms may not be related to diabetes itself, but only to metformin taken by patients with this disease. Therefore, if you have been taking this medication for a long time, I encourage you to have your B12 levels checked through a blood test. When it comes to people at risk of B12 deficiency, it is impossible not to mention vegans, because the only food source of vitamin B12 is almost exclusively animal products, such as red meat, offal, fish, seafood, eggs, and dairy products. I will come back to the topic of what to eat to provide an adequate amount of vitamin B12 in a moment. Some individuals who switch to a plant-based diet believe that they do not need to consume vitamin B12 with food because our intestines are inhabited by bacteria that produce this vitamin. Although it is true that beneficial microorganisms produce some amounts of vitamin B12, unfortunately, one key fact is overlooked. B12 production occurs in the large intestine, while absorption of this vitamin occurs in the small intestine, the earlier section of the digestive tract, and there is no possibility for the produced B12 to go back to the small intestine where it could be absorbed. So in reality, we do not benefit much from the B12 produced by our intestines. Other reasons for low levels of B12 include alcohol abuse, long-term use of oral contraceptives, chronic pancreatitis, or parasitic infections. During this break, I have a small request. If any of you would like to contribute to the growth of our community on this channel, all you need to do is click the subscribe button below the video, and then the bell icon that will appear next to it. If my videos are helpful to you, I think it's worth doing because subscribing will ensure that you don't miss any other valuable videos. If you have experienced the symptoms I mentioned earlier or are in the group of people at risk of B12 deficiency, as I have already mentioned, I encourage you not to delay and get your B12 blood levels checked. B12 norms are a somewhat controversial issue. Generally, a normal result is considered to be a B12 concentration in the range of 200 to 1300 picograms per millimeter or nanograms per liter. But, as I said, hidden B12 deficiency can cunningly develop even if our result is within the norm when it oscillates around 300 or even 400 units. Based on the literature data, I believe that the B12 concentration we should aim for is a minimum of 400 units and optimally, we should strive for a level of 800 to 900 units. In my opinion, the diagnostic problem with B12 deficiency is not only due to the underestimated norm, but also because the concentration of B12 in the blood that we measure does not fully reflect the body's saturation with this vitamin. Therefore, if your result is around 300 to 400 micrograms or below, it is a good idea to do additional tests. I am primarily referring to the measurement of homocysteine levels in the blood, which I have talked about before, and which increase due to a lack of B12. However, it is important to be aware that elevated levels of homocysteine do not always indicate a lack of B12. Increasingly, it is recommended to also perform a test for holotranscobalamin, which is the active form of vitamin B12. This test allows for the detection of B12 deficiency at an early stage. Another sensitive indicator of B12 deficiency in tissues is the level of methylmalonic acid, which can also be checked. Unfortunately, this test is very expensive, costing around 350 zlotys. In addition, a blood count can be performed to assist with diagnosis. Anemia due to B12 deficiency can be indicated by an increase in the volume of red blood cells, which is abbreviated as MCV. Additionally, We may see a decrease in white blood cells, platelet count, neutrophils, and a decrease in hemoglobin concentration. However, as I mentioned earlier, please remember that anemia is not always present in the case of B12 deficiency, so blood counts should only be treated as an addition to the diagnosis. Now, a few words about the supply of vitamin B12 and how to supplement deficiencies. To saturate the body with this vitamin, we should focus on a well-balanced diet. This means including foods such as offal, including beef or chicken liver, poultry and beef, herring, rainbow trout, salmon, eggs, as well as dairy products such as plain yogurt, kefir, yellow cheeses, and cottage cheese on our tables. At the same time, anticipating possible comments, I will say that plant products do not contain significant amounts of B12, because they do not have the ability to synthesize this vitamin. Of course, it may happen that bacteria that produce B12 will inhabit a plant, but these will be trace amounts, especially since this vitamin is not stable. By the way, I will also say that a certain amount of vitamin B12 can be provided by chlorella, a green-blue edible algae. On the other hand, another microalgae, spirulina, mainly contains a so-called pseudo-vitamin B12, which is slightly structurally modified B12 that does not have a physiological effect in our bodies. For example, is simply inactive. As a curiosity, I will mention that scientific societies have established a recommended daily intake of vitamin B12 at 2.4 micrograms. However, experts' opinions increasingly suggest that the current level is too low and that the amount of B12 supplied should be increased to around 6.1 micrograms per day. This just shows that some issues related to B12 are underestimated, and it would be good to change the previous view of this vitamin. And it is worth noting that recommended amounts of individual nutrients, including vitamin B12, are directed at healthy individuals. In the case of the course of many diseases, the demand for nutrients increases, but I will talk more about this another time. If we talk about people with low B12 levels, I mean below 350 picograms per milliliter, a good practice is to include vitamin B12 supplements. The recommended amount by me is from 500 to 1000 micrograms per day until the optimal concentration in the blood is achieved. However, it is better to split the daily dose into several smaller doses so that this vitamin is absorbed better. In turn, if anyone wants to slightly increase their B12 level in the blood, it is enough to take around 100 to 200 micrograms. I should also add that there is no risk of overdosing on this vitamin. There are several different chemical forms of B12, and I know that there is some controversy about which form is best. Without going into details, I will say that contrary to what is said and written in non-scientific sources, it is not that important whether it is, for example, methylcobalamin or cyanobalamin. There is also not much difference whether we reach for a capsule to swallow or a tablet to place under the tongue, but I talked about it in more detail in another video on the channel. For people who, for various reasons, do not respond to oral administration of vitamin B12, another option is to use B12 in the form of intramuscular injections. However, these should never be done independently because some people may experience anaphylactic shock. Unfortunately, these injections are also quite painful. If this material turned out to be interesting, I would be grateful for a thumbs up and writing in the comments which of the information I provided was the most interesting for you or sharing your own experiences with B12. That's all from me for today. Thank you for your attention. Don't forget to subscribe to our channel for more exciting information about your health. See you in the next video.